Good morning. Thank you for today. So yesterday we looked at the overall evidence-based medicine, and we looked at building a well-built clinical question. And one of the questions we did yesterday was this one on AML, newly diagnosed children. So among children with AML that's newly diagnosed, does standard therapy versus standard therapy with the addition of gemtuzumab lead to increased survival, as we were thinking event-free survival or overall survival? And we thought the study design would be best if it was a randomized controlled trial. I just wanted to go over that because we're going to come back to that a bit later as we go through today. So yesterday we went over in the well-built clinical questions, we looked at a background question, and we said that has two parts to it. It is a W5, which is a Canadian TV show, so that's how I remember it. You've probably never seen it, but so who, what, where, when, why, and how are the questions that you're asking, plus whatever the finding or condition of interest is. So those are background questions. Remember, we use background questions when we're looking for knowledge, we're looking for information that we may not know anything about. Then in the foreground question, that was the PICOS question. That's what this is here. That's usually attributed or seen when we're looking for clinical information about the care of our patients. So that is, the P is for the patient, the population, or the problem being addressed. The I is for the intervention. Sometimes in other studies it may be called exposure, but intervention is how we'll start. C is for the comparison intervention. O is for the outcome of interest, whatever interests you, whatever interests your patient. And S is for the study design or study type. So today we're going to move along, and we're going to go to the steps of EB, and we're going to go to the second step on doing a literature search. I'm going to apologize up front. I had hoped to have the internet connection so that we could play and look at some of the things. Mr. Ahmed has put this on the website, so you can go to the different search engines so you could try them yourself to look at them. But I'll explain why as we get through there in a bit later. So at the completion of this talk, you should be able to name the first two steps of evidence-based medicine, describe what a quality filter is, describe two steps on looking for the literature, and complete a literature search. And that last one, we're going to have to be a bit more adaptive today for that. So a literature search, as I said yesterday, is one of the 5 steps. It's the second step, and it's really using the best techniques possible to find the evidence that is out there. This is a whole skill set, and there's what I would call a colloquialism in Canada is called the quick and dirty. Doing the search as quick as possible and finding the information you need ASAP right away versus the more complex searches which you may use if you're doing a Cochrane search or you're doing a literature review. So in a lot of times at point of care, on the care of management of your patient, you want to get that information as soon as possible, and you want to do it at the moment the question comes up. If as the hospital is wireless, it's possible with an access to a laptop that you could get this question as you're doing rounds in the morning, as you're in the outpatient clinic, as you're in between cases in the operating room, you could find that information, or if you're down in the procedure room, you could find that information as soon as possible. And that's what I'd hope to have you work through today. So as I said before, we've gone to the 5 here, the PICOS. But last we're going to look is the type of study that you want to find. So we did the domain, but we're going to move down from there from therapy. So looking for the evidence, what types of studies are we looking for? Well, there's different, this is more back to the basic epidemiology of studies. There's descriptive studies where essentially you're describing what you're seeing. These are case reports. These are case findings, case series, where you're just looking and you're observing what you're seeing. And that might be the only information that's available. There's explanatory studies, which are observational, and there's experimental. Observational studies are where case controls, and I'm going to come back to this, cohort studies and cross-sectional studies are studies that a lot of times are used in pediatrics because you don't want to wait 20 years to find out the follow-up about your patient, so you use an observational study and you use some observational techniques. I will come back to that as we go through this morning. Experimental studies are essentially things under your control, things under the control of the investigator. The best one and the most common one we know is a randomized control trial. That is, the randomization and the intervention is under the control, which is different from an observational study, where we're asking, are people exposed to something by their own choice? But as soon as it becomes under your control, it becomes an interventional or an experimental study. And I'll have a picture of that later on. And systematic reviews, I put under the explanatory because if they are done correctly, if they're truly a systematic review, they are explanatory in looking at the evidence out there. They must be systematic at at finding the evidence, systematic at critiquing the evidence, systematic in putting the evidence together, and systematic in how the conclusion is brought. So it is an experiment in a sense. And hopefully next week I will go over a systematic review in the critical appraisal sessions. As I said, a descriptive study documents and communicates experience. The experience you had with that really odd case. There's a natural killer cell leukemia lymphoma on the ward right now. As we were talking yesterday morning when I was doing rounds, there's not a lot of literature out there on managing these. And in many cases, it was case reports or case series that are coming from Japan. It was interesting is that you've just had this weird case, and I've just had one at home as well. We came to the same conclusions by we haven't gone and reviewed the literature, but by reviewing the same literature on how to manage. So really what you're looking for is searching for the explanations in these different types of articles. Explanatory, as I said, makes a comparison. You're comparing groups. Where in a descriptive study, you're just describing what you're seeing in a group of patients. So in the observational ones, the cohorts, I'm going to show a picture about a cohort and a case control as we go through, but the investigator is observing what they're seeing. When I talk about prospective and retrospective, I'm talking about the view from the person doing the study. So if I'm doing a prospective study, the study is starting here, it's moving along, and the study stops, and I turn around and I capture the data. In a retrospective study, I start here and then I look back into history what's happened. And in most cases, case control studies are retrospective, and in most cases, cohort studies are prospective. Not in all situations, but if you're reading the general literature, that's what you're going to find. Cross-sectional studies are just a sample or a snapshot that's occurring in time. Taking a picture of what you're seeing and then comparing the two groups. So here's a case control study. Case controls, as I said, you find your population and then you look who's got the disease and who doesn't have the disease. And then you go back in a retrospective fashion. You're looking back into history. You try to determine, did that diseased person have the exposure? So a few years ago, probably almost actually 15 years ago, there was a big controversy. Does vitamin K given at the time of birth lead to an increased risk of cancer? And what people did is that they found children with cancer up to 7 years of age, and they found children without cancer, and they matched them so that they were the same gender, the same age, and born at the same hospital. And then they took those people that had cancer, and then they went to look, did they get vitamin K at birth? And they put that into one group, and then they found the group that didn't have vitamin K at birth. And they did the same with the undiseased population, and then compared those groups and determined a number called an odds ratio. A cohort study is prospective, usually in time, because what you're doing is you're looking for people who had an exposure, and then you follow them forward in time. So there's been a controversy when computers and video display terminals first came out, when there were these huge honking TV sets on tops of the desk. There was a concern that women were having an increased number of abortions, spontaneous abortions, because they were sitting in front of a video display terminal. So what they did is they got a group of women, and then they determined who had been exposed to a video display terminal, who was unexposed, and then they followed them forward in time to see during their pregnancies whether or not they had a spontaneous abortion. So we moved from the explanatory observational studies to the explanatory experimental studies. These are things that when they're under the control of the investigator is introducing an intervention to that patient. That patient may be randomized to treatment or no treatment, but that intervention is under the control of the experimenter. And these are things you'll see different words when you're searching. And they have different variability of quality of study. So there's a control trial where I give the treatment, but I may not have really randomized the patients. I may have said, if you come to the outpatient clinic on Monday, I'm going to give you this treatment if you have a problem, but if you come on Tuesday, I'm going to give you the other treatment. And on Wednesday, you get the treatment, and Thursday. So it's not truly randomized. It's controlled, and the intervention is under my control, but it doesn't meet the criteria of good randomization. A randomization trial would be that I would have a randomization system, a computer program, or an office away from there that does the randomization themselves. Then you may use a placebo-controlled, as you're aware, to try to blind or so the people don't know what the treatment they're getting. And you may double blind, and we're going to talk about these terms as we go through the critical appraisal sections in the next few days. Bench studies in vitro in animals are truly experimental intervention studies on non-human subjects, so they do fall under this, but sometimes it's hard, as you guess, if you're looking after monkeys to try to extrapolate that to humans. So here's just a pictograph, a cartoon of the randomized controlled trial. And the reason that this, this is in the blue is because this is under the experimenter's control, whether or not they get the intervention or not. And then you just follow those people forward for disease. Unfortunately, in many cases of late effects of childhood cancer and that, these studies aren't easy to do because you're waiting 20 to 30 years to get information. Long by the time I will be in an old folks home and my children will be feeding me pablum, I'm sure, but that's a long way to go. So we use them when we can for treatment, but they don't always lend themselves to other studies in childhood cancer. I just do want to mention systematic reviews because a lot of times this is filtered literature of high quality, and it is more and more information is out there. There's actually now a Cochrane Childhood Cancer Review Group, which we're moving through developing some protocols and developing documents to help do that, so that we can provide, the Cochrane group can provide the information that is most up to date. As I mentioned earlier, it is a systematic approach to selecting to searching for those articles, casting as broad as net as possible to capture all the possible articles, and then working through and searching through those articles to find the articles that are actually relevant to that well-built clinical question you've done, and then selecting the high-quality selecting the articles and assessing the articles on the quality of those articles, and then critically appraising those articles, and then trying to put the numbers together to get a synthesis of all the relevant studies. A meta-analysis is a component of a systematic review, but not all systematic reviews have a meta-analysis, and not all meta-analyses are a systematic review. So just remember that when you're reading, if somebody says, well, there was a meta-analysis, it doesn't automatically mean it's a high-quality systematic review. And sometimes when you're reading systematic reviews, you'll be frustrated because there is no meta-analysis. Yesterday, there was a question, and we talked about the levels of evidence, alluded to the levels of evidence, and I just want to allude to that again as we build up the searching techniques as we're going through this morning. Some people will start actually with a pyramid that is a meta-analysis of RCTs, so systematic review is at the very top. Good quality RCTs, and then systematic reviews of observational studies. Remember, the observational studies are case control, cohorts, and cross-sectionals. Then there's physiological studies, and then there's unsystematic clinical observations, case control, case series, case reports, and things like that. Some people do put N of 1 studies at the very top of the pyramid now. An N of 1 study is essentially where you work with, in many cases, with a pharmacist and have a drug, and you have a placebo, and really only it's hidden behind. Nobody knows whether the patient gets the drug or the placebo. They usually only lend themselves for very quick cases where you're looking for a quick treatment or a quick response. In childhood cancer, they wouldn't really lend themselves because you're looking at such a long-term outcome. So there's not a lot of situations, but maybe some of the symptom management things that you're doing with children with cancer, such as whether or not to use a new mouth rinse or something like that, may be a way of developing an N equal 1 trial. So I'm just going to go through some of the different domains and talk about what are the highest quality studies. This is just to reinforce the idea of that. So in therapy and prevention, you want a double-blind, randomized control trial or systematic reviews of such studies. And if you can't get that, if you're looking for searching, then accepting a prospective control trial would be the best quality of evidence for therapy and prevention. In etiology, cause, or harm articles, these are all essentially, most cases, case control type studies. You will get some information from RCTs or systematic reviews, but most cases it's going to be retrospective case control studies that are the best that are available. And we'll come to talk about that in the next few days. Sometimes, and rarely, there are prospective cohort studies, which may be possible, but that again is rare. Diagnostic studies are different again. In doing a diagnosis, this is really a prospective cohort study is the most helpful, but in many cases you're just going to get a cross-sectional study with a blind comparison. Again, in this, looking at a diagnostic test, as we go through a critical appraisal of that, we'll have to define what a gold standard is, and we'll come to that in the next few days as well. Prognostic studies are, does that patient develop late effects, and that could be a prognosis study. So you could use, you need a good inception cohort studies or a strong inception cohort study where the patients are, that you know all the patients are the very same when they're starting the study. So the answers to the clinical questions of where do I look first and what do I look for lead to going through first principles. And the first principle is you need to go for quality filtered, pre-appraised literature. What you're doing is relying that somebody has done the work for you. It's not bad. You don't have the time. You're busy clinicians, you're seeing patients, and you want a trustable group of people who have quality filtered that literature for you. They've done the work for you. Essentially, there's a bottom line, the information's there, you can make a quick decision, you know it's been done properly, you know it's been vetted. The place to go for that information in many cases is like the ACP Journal Club, which if we have internet connection in the next few days, I could show you that one as well. And evidence-based medicine is a paper journal, but is also online through Europe. We don't have access to it in North America, but it's very similar to ACP Journal Club. The two actually work together. It was worked by Dr. Paul Glazeau at the University of Oxford. And it's really, the first thing is if you can find the information there, that's the quickest way you can make a decision, you can get the bottom line, you can change your management, alter your management, confirm that you've done the right thing on your patient, and move on. If you're looking for background information, so this is information like where you need more medical knowledge, there are evidence-based medicine, evidence-based documents out there that will help you. You don't have to go back to Nelson's textbook or PISO, Principles and Practice of Pediatric Oncology. That may be where you need to go, but you could actually start by looking at evidence-based sources. There's a wonderful source run by the BMJ called Clinical Evidence, and I'll give you the website at the end. It is a filtered source. It's a very easily web-based site to find the documents. Clinical practice guidelines can be helpful, but in many places you've got to be careful because the clinical practice guideline needs to have a systematic approach to it, but in many places the definition or the relevance is actually to someplace in Brazil, someplace in Canada, someplace in Europe, and it may not be relevant to your population. So that's the danger with clinical practice guidelines, is that they may not be relevant to who you're caring for. Other options are clinical decision rules. There's a few excellent websites, not in oncology, unfortunately, pediatric oncology that I've seen, but for sprains and strains, there's a really neat website that comes out of New York City. Other things are to look for current review articles based on research literature or where a systematic review has been done. And a lot of these are found also in clinical evidence or another database called the TRIP database, which is very excellent. If that doesn't work, then you can go to standard clinical textbooks, but there are also some ones that are kept up to date. Up to date is doesn't have a lot of pediatric oncology in it as yet. It's very expensive. For our university, it's an online journal. Our university looked at purchasing it. Our health sciences library has a very strict policy that everybody needs to have access to the website from anywhere. So I can access that website if I'm here in Cairo or if I'm at home. And Up to Date would sell that to our university for $500,000 a year. And so our university said there are better sources of information we can purchase. And so that's what we elected to do. There are other medical textbooks, MD Consult out of the States, StatRef is very useful. Our university is signed onto that. Access Medicine and books at Ovid are all different background informations that are quality literature that is essentially kept up to date. If you're going to a well-built clinical question, ongoing management, so back to a PICOS over here, then the place to look is to look for filtered or pre-appraised literature. Cochrane Library, ACP Journal Club, and hopefully in the Cochrane Library in the future there'll be more critical appraisals and systematic reviews of childhood cancer. Other evidence-based journals such as Clinical Evidence and Best Bets, and if there's an appropriate database to search the journal literature using Medline, PubMed, Embase, which is the Elsevier group's database, Web of Science. Unfortunately still, with a lot of these databases, and we found this out at our institution, we have a program for complementary and alternative medicine, herbal medicine, herbal therapy, and we found that we are unable to search most of the literature from China, where there is a huge database of alternative therapy. And we have Edmonton in Canada is the most ethnically diverse city in our country. We have populations from all over the world that live there, not in some cases just not a lot of people. So we see a lot of herbal remedies and herbal and alternative therapies, yet we don't have a way to search that information correctly. In Ottawa, we're working with the University of Ottawa to develop a database which will hopefully go electronic, which will allow access to a lot of the Chinese medical literature. But remember, there's 1 billion people there, of which we don't have access to some of the health information from those places. Again, always use a quality filter when searching for the evidence in a bibliographical database. And I'm going to show or talk about these a bit on, and I'll give you the websites that you can look at them. So as I said before, we're looking for randomized controlled trials in therapy articles. If you have to choose one term, so if you're going into PubMed, and you want to find a document and you're just going to quickly search PubMed, is to add AML and, in capital letters, clinical trial. And that's one way of doing it. If you want to, other things that you can do is in PubMed is go AML and double blind and placebo, and that will give you the best searching techniques to get the best articles quickly. There is a better way to do that, and I'm going to explain that in a second. I look first in, again, quality filtered. All these I've mentioned. There's an interesting thing called the Cochrane Central Registry of Controlled Trials. As you do a Cochrane search, as you are developing a Cochrane document, any articles that you find, you ask to be placed in this database in England. So you have access to all this information. Everyone has access to clinical trials. So if I'm doing a Cochrane database search on childhood cancer on a certain topic, and we're working on one right now for AML and bone marrow transplant, we're looking at whether or not any trials we find, if we find trials from China, that document will be deposited in the database in the Cochrane Library, and you can search that to find that article as well. You may not find it in Embase or ACP Peer or in PubMed, but it's worth searching if you know there's a weird article or you're not having any help in getting there. Clinical practice guidelines, again, caution, caution, caution. They're good, but they're only good if they're current and they're from a reputable source and they've explicitly stated the appropriate levels of evidence they're using. If those don't work, then go to Medline or PubMed. Limit it to RCTs or a meta-analysis, which you can do in the Ovid version of Medline. I'm not aware which one you have access to here. It's interesting in surgical questions, if you do these things, you may have problems. So there's some suggestions for surgery. In many cases, you can't randomize somebody to have a limb salvage procedure. You're not going to randomize to or no salvage procedure. So in many cases, use cohort studies. Cohort, these are keywords or comparative studies in the terms. That doesn't work. This is where I go usually right off the start, is PubMed clinical queries. And I would like to show you that at some time. When you go on the PubMed page, so it's www.pubmed.gov, and I don't know if that's where you search, but it's a really quick source. You can click on the left-hand side in the bar, about halfway down the web page, there's a thing called clinical queries. And what clinical queries does is it takes you to another hypertext web page, and on that hypertext web page, it determines what you're searching for. There's the first one, systematic reviews. You type your word AML into systematic reviews, and it will pull up all the systematic reviews. If you want to add the treatment to that, it will help you in that way. If not, you can click on therapy, which is just below the systematic reviews word, type it in under therapy, and it automatically applies a complex quality filter to the whole search. It's written and it's hidden behind, you can see it if you want to, but it's hidden behind in the software, and it applies all those quality filters to give you the most up-to-date, using the word controlled trial, using randomized, using placebo, using comparative studies, and it does that to give you the greatest number of documents. It's a really good way to limit your search, and usually this is where I start if I'm searching for something, is I go there, and if I'm only getting one article and it doesn't look relevant, then I go back out to PubMed, to just general PubMed. So clinical queries, remember that one. Diagnostic studies are a bit more difficult. Most cases are going to be prospective, and they're going to be an observational type study in that. So in that case, you want to use words that are observational. So sensitivity is a good word to just type in. So you're looking at a new diagnostic test for, say, CRP, and you want to know, you put CRP and sensitivity, that would be the best way to get the best search. As you'll see, you can add other words in here, predictive value, sensitivity, and specificity. This is because the mesh headings only look for these words. There is no mesh heading that actually looks for diagnostic test or looks for sensitivity and specificity. Oh, okay, thank you. I'll come to that in a second then. Will there be a way to put this one, Ahmed? Mr. Ahmed? Will there be a way to put this onto the internet, like the screen? Yeah. So I can just switch computers later on?
I can set up this on this computer.
Okay, well, I'll do that in 2 minutes when I get to the part, and we'll just talk for a second. Okay, so diagnostic test, thank you. Again, similar things to before, and this is essentially the pattern runs through as we go through this. Cochrane database does have some systematic reviews for diagnostic tests and clinical decision rules. I would look in Medline first. I would do an explosion. I would look for all studies where all this is mentioned relative to the diagnostic test. And I would also go to PubMed clinical queries. I'd click on clinical queries, and there is a diagnosis button, a radio button that you can click on, and it will choose specificity and it searches for you as well. So it's very quick that way. Prognostic studies, you want studies that have had 80% of the patients were found at the end. That's sort of a general guideline to give you the articles. Again, I would explode cohort studies. You can type in cohort studies into PubMed or prognosis or survival analysis or other keywords. This is all available on the website that Ahmed has set up, so you can find this information there. There are evidence-based medicine textbooks for that are sometimes have some good prognostic articles in. There's not a lot in pediatric oncology, but if you're looking at other topics, again, mainly symptom care and symptom management, you can find them here in these different websites. Then I'd go to Medline, as I said before, or survival analysis is another word for prognostic studies. But again, clinical queries is where I usually head at the very beginning. And I choose the specific radio button for when I do that. I'll show you those in a second as we get there. In etiology, cause, and there's risk is the major word you want to use, and I'll show that as we go through. Again, a lot of times etiology and harm articles are drug reactions. So this is a good place to go, is an evidence-based drug handbook such as Medicines Complete. And is a good one to find adverse drug reactions if you're looking for harm. Again, if you're going to Medline, you can choose case control studies, or in PubMed, you can go to clinical queries again and choose specificity. There's two options when you get to clinical queries, and I'll show you. They're specific and they're sensitive. Systematic reviews are as good as the quality of the studies that are included in the review. And so really what you want is, if you have weak studies, you're going to get a weak systematic review. So you want people who do it with rigor. And we'll go over that when we go over a systematic review next week. There are pre-appraised sources. As I mentioned, there's the Cochrane database of systematic reviews. There's a database of abstracts of reviews. There's a Canadian website of health technology that is good for if you're looking for technology assessments. Diagnostic imaging is in here. Laboratory studies are found in here. It's a good place to go. And ACP Journal Club does have a few as well. If you're looking at searching Medline, you can type in the word meta-analysis, but the quicker thing to do is, again, to go to clinical queries and search systematic reviews. So as a fundamental part of your thinking about the elements of a clinical question, you really, again, need to know what is the type of question you're going to ask and where can you find that information. And those are the questions we're going to consider as we go through. And this is just a summary that I'm sorry, I meant to hide these slides when we were going through because this is available on the website. But I do want to look at some studies, go back up one. So sometimes prevention studies are what you're looking for. Again, they follow very similar to the quality of randomized controlled trials. But these are the health services research topics that I talked about last time. So cost economic analysis, you're going to look for economic questions in searching, self-improvement in education, healthcare for patients, quality improvement, quality assurance, health services research, and differential diagnosis are all possible study designs which may take in a variety of different types of clinical studies or type of cohort, case control, case reports. And again, it depends on the what actually sphere of those you're looking for. You can always, I would always start with a quality filter. I would go to TRIP or TRIP database or something to see if those are there, and I'll show you that in a second once we go live with the internet. So in summary, we've been looking for the literature, we've talked about quality filters, we've talked about searching principles for therapy, prognosis, harm and etiology, and diagnostic tests. And I would like to go to this, so if you, can you install for a second? So, was there any questions or anything about searching? This is, really you've got to go and do this yourself. Yes? Okay, so a systematic review go back to a systematic review is not always a meta-analysis, and a meta-analysis is not always a systematic review. A systematic review is a systematic approach to searching for the information, to developing your question, to searching for that information, to assessing the quality of that information, to put that information together and develop an outcome. Now, in some cases, I can do a systematic review, but I cannot find any randomized controlled trials. And so I have completed the systematic review, but there are no observational studies of good quality or randomized controlled trials of good quality. So therefore, I cannot do the next step, which is a meta-analysis. In many cases, I will find 4 RCTs, randomized controlled trials. I will put that information together in a mathematical approach, and I will develop a meta-analysis. So the meta-analysis is actually the statistics part of a systematic review. So that takes to the point is that I could do a meta-analysis because I have found 10 studies that I really like, and I'm not really concerned about the quality of those studies. So, you know, one's really weak, they randomized by, they didn't randomize the patients, and some patients knew they were getting drug A, and other people knew they got drug B, and the doctors in the study really liked drug A, so they would take patients out of the study, or halfway through they'd give them drug A. So that's not quality. So I can still do a meta-analysis because I can do the statistical tests because I have 5, 10 trials that are randomized controlled trials, but the randomized controlled trial is not of high quality. So you can do a meta-analysis on, you can do statistics on anything, but it may not be a systematic approach. Does that help? Does that make sense? Okay. Other questions? Or really, searching is something that you really need to experience and do yourself. And so I'm going to pop up some websites. We're going to go through this PICO here. So we'll do, because it's a simplistic one to do while we're here in a large group. But if you want some time, I'm happy to work with you doing searching. There is a searching place. There's computer access. We can get online and take a look at quickly doing some searches. Other questions? Or so I've been on rounds yesterday morning, and we had some very interesting patients. And the thing, going back to the whole questioning thing, there is lots of questions out there. And just hearing those questions as we're doing rounds in the morning, as I go to handover rounds in the morning as well, there are questions all the time that people are asking. And it's just, you've definitely got a culture where you can ask lots of questions. And I encourage you to take that the next step into finding some of the evidence out there. Even if it's well known, sometimes it's really nice to go back and find the original article which everybody's talking about versus just looking for a protocol or a policy, to find that original article that helps you manage your patient. And a lot of these can be done, a lot of the questions we dealt with yesterday morning were infectious disease questions, and sort of symptom management of our patients, feeding our patients. I'm learning as I go through here about your approaches to anti-nausea management, which are different from mine, but are wonderful in the way that you've come and people talk about how they've got to those decisions. Feeding and nutrition despite 2 different cultures, we have a very similar approach. We do have a dietitian, so our dietitian sits in rounds with us every morning and talks to us about patients. We have a pharmacist as well who does rounds with us. So a lot of times we've created a culture in our much smaller institution to constantly ask questions, and I use the help of, when I do have pediatric residents or fellows, that we make a list of questions at our institution that come up in the morning. And sometimes they're dietitian questions, and the dietitian goes off and searches for the articles, or the pharmacist will go off and do a lit search and find the latest articles as well. A lot of times it's been quite interesting because, as I said, we're a very ethnically diverse city in Edmonton, and so we do have a lot of alternative therapies and drugs and herbs that are being brought in. We also have about 15% of our population is what we call First Nations or Aboriginal, and they have a lot of homemade cures and remedies that are made by their medicine man, which are brought in. And we had a fascinating situation of 2 patients who died very quickly, both who had been given a medication. And unfortunately, what happened is they were both, one was a medulloblastoma and one was a high-risk ALL. The high-risk ALL was on induction chemotherapy. The medicine man came in to give this concoction of medicine that he had made, a tea drink. And about 12 hours later, for the first patient, that patient said they felt unwell. They had a tummy ache. They had no fever. They were neutropenic. And they grew a very, their blood pressure started to drop. They looked like they were in septic shock, but the whole time they had no fever. And there was no other signs. Yet you knew this patient was going into septic shock, yet your classic temperature problem wasn't there. And it turned out that patient had a very odd bacteria that they grew of, I can't even remember the name, it was so complex. Pardon? Actually, that's what it was. And then we had the second patient, two doors down. The medicine man came the next day, and the same thing happened again. And so we haven't seen this in the situation. The tea was made, and we analyzed the tea, and the bacteria was in there, and it was devastating because both the children died very quickly within 24 hours of a fulminant sepsis in our intensive care. But again, trying to find information about this tea required a very complex search, which the librarian did as well. So I'm just going to enter the URLs, and then I can quickly show you PubMed, TRIP database, Google Scholar, and talk about those to you. Oops, I just lost the connection. No, thank you. So do people here use PubMed? Is that where you go, or? Yeah, so that. Thank you. So PubMed, if you said, as I looked over here, there's clinical queries over on the side here. I just click on that. Sorry, I'm used to a Mac, so I only click once most times. And you'll notice here, as we go through the page, search by clinical study category, find systematic reviews, or medical genetics databases. PubMed has a neat thing. You can use Omen, and you can search, especially if you have odd diseases. It's actually an excellent resource for different diseases to look. But here's the, I'm just going to go down to, scroll down the page. Finding systematic reviews. So here you just enter into here, we can just enter AML. I think I have to type, I don't know if it'll take AML. And click go. Oh, it's going? Okay. So even for AML, the quality filters have applied have cut that down to 193 articles. Now, I'll go back and we'll go back to and show the different numbers. So it's already applying, it's only looking for systematic reviews in those topics. So I haven't applied any filters. I haven't said childhood AML. I haven't put in gemtuzumab or anything like that. Page back is backspace. Sorry, our page pushed. So clinical queries, and then we'll go down here to here. Here is, just come up a bit, search by clinical study category. So you'll notice these little radio buttons on the side, which I was talking about. So these are, again, the core things that I talked about yesterday, the core domains: etiology, harm or causation, diagnosis, therapy, prognosis, and clinical prediction guides has just been added. Therapy is the default button, so if you don't click anything, you're always going to get therapy articles. And then they give you they have two sub-searches that are hidden behind the screen here. called a narrow search, which gives you very specific information, and a very broad or sensitive search. So capturing every single thing about AML and gemtuzumab. So let's just type in AML, and I'll see if it'll take the short form of gemtuzumab. We'll go for therapy, we'll go for narrow studies, and we will click. It's going, sorry. So it's so refined that it's probably not taking the gemtuzumab word. So I'll just go back and I'll show you just if we look at AML only. So I have applied no limits here. You can choose to limit your studies. So for AML, there are this number of randomized control trials or controlled trials, of which 25 of those are reviews of some sort of systematic review. You can apply limits by clicking on here and setting the age. So if we just wanted to look for all AML studies in children, we click on the limits. And you'll note that you can search if you know there's a specific author or a specific journal you want to do. But you can also scroll down, and in many cases it's helpful is that you can select ages. And just because we're in pediatrics, there's several options. You can do all children, which is from birth to 18 years, or you can do all infants, which is birth to 24 months. Infants is different in Ovid. In Ovid, infants is 0 to 12 months. In PubMed, it's 0 to 24 months, just so you know. So if we click on all children, and we go down to the bottom of the page, and tell it to go, it's now going to take all those AML studies I searched, and it will find, we went from 800 down to 400. So of these 400 studies, they've had somehow had involvement of children. It may be an adult study that has a 17-year-old in it. So caution that way. That qualifies it to fit into this filter. How do I get a URL, the screen back up so I can have a URL? So I can type in a new address? Okay, great. This is TRIP database. It is a search engine out of England. It was originally going to cost everybody money, but once the guy tried to make money on it, it didn't go. So he made it public again. It's a nice search engine. When it comes up, I'll show it. You can register for it. It does automatically. It helps you if you want to find medical images. So if you see a rash and you're not too sure about it, you can find a rash. If you want some patient information, it's in English. It'll be here. But evidence-based medicine. So if we type in AML again, so the nice thing about TRIP database is it automatically applies filters. So I typed in AML, I didn't limit it or anything, and it's given all these different articles, but what it's done is that it tells me on the side, and this is what I really like about it, is that it gives me systematic reviews. It tells me evidence-based synopsis, so these are evidence-filtered resources. It tells me guidelines that come from North America, that come from Europe, that come from elsewhere. If there's clinical questions, so clinical appraisal topics, if there's core primary research that is clinically relevant, primary meaning primary care research, evidence-based medicine textbooks, and other things. And you can actually filter it by specialization as well if you want to. But so in many cases, if I don't know, say there's a new drug out there and I'm not really sure what it is, I can type the word in here, it'll give me, and I can go straight to the e-textbooks and find a bit of background information, and then I can quickly look at a systematic review or an evidence-based medicine synopsis to find the information. It's free, it's really easy to use, and it makes your search very quick if you're looking for information very quickly. I do want to show clinical evidence. Sorry, just go to the top. See if I can get through it into my university website. Oh, did I? If not, we'll just go to clinical evidence. But You can get to this clinical evidence through the BMJ website, but the advantage is that I just know the clinical evidence, so I just website through my own university better. So this is clinical evidence. It also provides it in different languages at the top. It gives you a direct link to the journals, but it also has educational things and information. So if we wanted to search AML, we could just go here. And the nice thing is that it combines a background level of information. It's going to have to take, it's a British system. I'm just typing acute leukemia to see if it works quicker. So I just typed in leukemia. There isn't obviously a lot out here. But first line, there we go. If you go here, if we're, what it does nicely is it has a composed list on the side here of clinical questions that have been looked in about Hodgkin's disease. So if you're interested in Hodgkin's disease, people have already done the work for you to critically appraise this. So a lot of times it's very nice is that you can go through your full reviews, you can click on oncology and find. But the other thing it does, specifically for Hodgkin's, is it gives me key points. So if I want a quick rehash about something, it tells me about the condition. So if I want background information, if there's updates on management or therapy, it gives me those. If there's clinical practice guidelines, if there's references, it provides all these different options. It's a wonderful resource. It is available through the BMJ, and most cases, most places will have access to this. You can go to just clinicalevidence.com. The last one I want to show you is just called Google Scholar, because a lot of people have been talking about it. Google Scholar is Google's attempt to search the literature. And, okay, I'm going to, bear with me please, I'm going to have to accept this option. But what it does is it searches health sciences literature. I'm not exactly sure the filtering. The health sciences librarians who I've talked to are relatively happy with it. When do I use Google Scholar? If I've searched for something and it's a really odd topic, or I'm not sure of the spelling, or I'm not sure if there's somebody involved in it, and I want to type in names, because it gives me that different. It will give you thousands of results, so it's not a very good filtered resource, but in many cases, we had a kid with bronchopulmonary blastoma, of which there is a few articles out there, and you can search through PubMed. But when I went through Google Scholar, the second choice was actually a website run by a foundation in the United States, and it had all the references built right into their website, which were from JCO and JAMA and New England Journal and BMJ. So it was very helpful that way, because I wanted information, but I wanted it quick, because I heard there was a patient coming in and I was going to get a phone call about this, so I wanted to sort of have some background. I'd never seen a kid with it before and I wasn't sure, so it was a quick way for me to get information versus sort of sitting down and reading all the PubMed abstracts and trying to get some background on what type of tissue it came from and things like that. Was there any questions? So that's where I'm going to leave it right now. Thank you very much. Please try to play with these. Take a look at TRIP database. You'll find it quite useful and quick for yourself. So thank you very much.